Good afternoon. Since Friday, May the 8th, we have seen a 16% increase in confirmed COVID-19 cases here in Baltimore City. As of this morning, the city has 3,404 reported cases, 396 people hospitalized with COVID-19, and 169 deaths. We remain focused on continuing to scale up our response to this emergency to ensure residents of our city have the resources and support they need at this time, while continuing to leverage the wealth of medical and public health expertise right here in the city of Baltimore. I want to remind residents that they are encouraged to call their doctor or 211 for coronavirus symptom screening and to be connected to a physician for assessment. I know I probably sound like a broken record because I keep saying the same message every week, and citizens remind me of that, but it's that important. We need everyone to stay home unless you need to go out for essential reasons. If you must go out for an essential reason, everyone should be wearing a face covering. This covering isn't for you. It is to protect everyone you come into contact with. It represents that you care about your fellow residents and their well-being. And I want to thank the majority of Baltimoreans who have heeded the warning and followed the guidance. You are the reason we have made progress flattening the curve, but we need everyone to stay focused and vigilant. We cannot stress this enough. Avoiding hospitals and healthcare facilities when possible can save lives. Now I will ask Baltimore City Health Commissioner Letitia Zarasa to update you on our COVID response and our work to support the residents of Baltimore City.
Good afternoon. Thank you, Mayor Young, for your leadership, and thanks to our partners for their continued efforts to support Baltimore City during the COVID-19 pandemic. Today, I'm proud to announce that Baltimore City began accepting residents at the Triage, Respite, and Isolation Support Center at the Lord Baltimore Hotel. We brought in the first residents to the Tri-Support Center this morning and are accepting referrals from hospitals, testing sites, and medical professionals. The Tri-Support Center only accepts residents who are COVID positive with mild or moderate symptoms by referral through a centralized intake process. By accepting referrals from hospitals for people who, due to their living situations, may have difficulty with self-isolation, this partnership will reduce the number of interactions among residents who are positive with those who are negative. This includes residents who live in multi-generational households, members of the immigrant community, people experiencing homelessness, frontlines workers who wish to reduce the risk of transmission at home, and others who live in congregate settings or living situations that make it difficult to self-isolate. Through the partnership between Baltimore City and the University of Maryland Medical System, the hotel will be staffed with resident and clinical support staff. Meals and cleaning services will also be provided. This is an important city resource that will be available for the coming months as we continue to respond to the COVID-19 pandemic. As a reminder, please continue to follow the stay-at-home order and abide by social distancing and face cloth covering guidance. In order to keep yourself and your loved ones safe, do not go out unless you're performing an essential job or task. If you are celebrating a graduation, birthday, or special event, consider connecting with your friends and family virtually. If you are going outside to get some fresh air, get some exercise, or walk the dog, please remember to abide by social distancing measures and wear a face cloth covering over your nose and mouth. Thank you. I'd now like to turn it over to Dr. Kevin Burns, who is the clinical medical lead for the University of Maryland Medical System at the Lord Baltimore Tri-Support Center.
Good afternoon. I want to thank Mayor Young and Health Commissioner Dr. Duraza for their leadership and being able to be partners with them. I'm the medical director for the University of Maryland Medical Center, University of Maryland Medical Systems TRICARE support. So I'm the clinical lead working directly with the Mayor's Office and the Baltimore City Health Commissioner in this partnership. And yesterday, touring the facility with Dr. Mohan Santa, the President and CEO of the University of Maryland Medical Systems, we're thrilled to be able to support in this time of crisis in what is happening in Baltimore and around the country and around the world. I want to acknowledge that what Baltimore City and the Health Department and the Mayor's Office has already done has been heroic. They have prevented thousands of COVID infections already, and we are very privileged to be able to join them in partnership to support the next increase in that capacity. With the opening of this facility, thousands of COVID infections will be prevented, and emergency room admissions, people going into the intensive care unit, and deaths will be prevented by this facility, and that's of Baltimore City residents. So in closing, I just want to say that please, we also want to echo the recommendations of Mayor Young and Dr. DeRosa in terms of continuing social distancing and hand hygiene, and please follow the health department and the mayor's office recommendations so that our city can be as safe as possible. Thank you very much.
Thank you, Dr. Burns, and thank you to UMS for your continued partnership as you work to support residents during this public health emergency. The COVID-19 pandemic has caused hardship in so many ways. As you know, this pandemic is not only a health crisis, it is an economic crisis. Tens of millions of people across the country have lost their jobs and have no source of income. Among the consequences that record unemployment and job loss create, many could be threatened with the loss of their housing. And even though I work with the sheriff to ensure evictions would be on hold during this state of emergency to protect those residents who cannot pay their rent, people are now worried about accumulating back rent as we prepare for the recovery phase of this challenge. To that end, I have directed our housing commissioner to establish a program that will provide temporary rental assistance to those that will need continued relief. This will be a targeted initiative to address a very specific problem where there has been a COVID-related impact and no other source of assistance has been provided. With our Community Development Block Grant COVID allocation, I'm prepared to commit $13 million to such a program. Directing these funds to rent relief will go a long way to stabilize our residents and support them through the recovery period. In addition to the human cost of families potentially becoming homeless, the eviction, shelter, and rehousing process will be a high cost for both landlords and the city. For the city's overall economic health, we need to prevent any potential wave of eviction caused by COVID-19 impacts. I expect to be presented with options for a workable program within the next few weeks. We are working with all stakeholders, including the industry, housing advocates, and our state partners, to hash out the specific details of such a program. I also want to thank the Annie E. Casey Foundation, who has stepped up quickly to provide the kind of technical assistance we need to help us stand up a program in a matter of weeks. I'm confident we will be able to provide some measures of relief to this potential housing crisis and bring relief to renters in the short term. Now I will have our Housing Commissioner, Michael Braverman, come up and talk more about the initiative. Mr. Commissioner?
Thank you, Mayor. Good afternoon, everybody. I'm Michael Braverman. I'm the Director of the Department of Housing and Community Development. I want to thank the Mayor. I think the Mayor really said it all. It's an extraordinary need in the city of Baltimore right now. And listening to the Mayor and Dr. DeRosa, we know, we need to keep people in their homes. We always need to keep people in their homes. Essentially, this is a time during this pandemic when it's so much more important to be vigilant. And I thank you, Mayor, for dedicating those $13 million of CDBG COVID funds as the sort of seed capital to launch a program that could keep people in their homes who have had substantial impacts. So it's a really important deliverable for Baltimore, and we have a lot to do in a really short period of time. And we can do that, and I'm comfortable we can do that, because of the commitment and collaborative approach of our partners. And I want to double down, Mayor, and thank the Casey Foundation for enhancing our capacity to deliver in such a short turnaround time. So I'm looking forward to the work ahead. It's with our state and our federal partners, our tenant advocates, some of whom are here, representatives here today, our industry representatives, our sister cities that we're working with, and of course the great team at the Department of Housing and Community Development and the Mayor's great team across city agencies. So we're looking to cover 3 months of April, May, and June. Program is looking to be that kind of assistance for our residents, tenants in the city of Baltimore at 80% below of AMI at the first cut for April, May, and June assistance. And I'm very confident, Mayor, that we will get you that program in time. Thank you.
I want to thank you, Mr. Commissioner, for your abilities to get things done. So to all the men and women of DHCD, thank you for your tirelessly working on behalf of the residents of Baltimore. Now we have Matt Hill, an attorney and representative with the public justice system, to come up and speak.
Thank you, Mr. Mayor. Thank you, Commissioner Braverman. I also want to acknowledge Carolyn Johnson from the Homeless Persons Representation Project, who's here as well. Again, my name is Matt Hill. I'm with the attorney with the Public Justice Center. The Public Justice Center and the Homeless Persons Representation Project provide legal assistance to tenants who are facing eviction. And I can tell you, since this crisis began, we have been inundated with calls from tenants who are unable to pay their rent. They've lost their job, they've had unexpected medical expenses, and they've told their landlord they're unable to pay the rent, and now the landlords are threatening them with eviction. So we know that housing is health care. We know that you can't remain healthy if you don't have a home. And so now, more than ever, we need to prevent every eviction possible as we build toward a full recovery. The Mayor's Rental Assistance and Eviction Prevention Program is an excellent start to address this looming wave of evictions as unemployment soars and thousands of families can't pay the rent. These funds will be invaluable to assist tenants and landlords in avoiding eviction by paying the past rent due and providing tenants with access to legal representation in order to hold landlords accountable for complying with the new laws related to eviction and to make sure that the properties, are fit for human habitation. So now is the time for the federal government and the state government to step in and provide additional assistance. Again, I want to thank the Mayor for this innovative program. It's a huge relief, and we look forward to continuing to work with the Mayor and the City Council to address this important issue. Thank you.
Thank you, Matt, and thank you to all of our partners working to provide support and relief for our residents at this trying time. The impact of COVID-19 emergency on housing stability has been a concern of mine from the very start, and this new initiative will bring much-needed relief for renters. Now we'll take a few questions. Oh, thank you.
This is for the Health Commissioner. I know he asked this question a lot, but has there been any further detail as data comes in every day and test data comes in every day about what sectors of the population are being tested? In other words, is it all nursing home? Is it all healthcare workers? Is there any further data?
Yes, I mean, we certainly know that according to the criteria that was set before, that it is going to be people who are symptomatic. Specifically, the initial criteria really focused on people that were symptomatic and within the hospital. With the governor's more recent executive order, we are expanding testing to all nursing facilities. So with the support of the state, we're really looking to get into nursing facilities, understanding that there is a large population that may be asymptomatic or pre-symptomatic, but positive within the nursing facility. So that's certainly also been a very highly tested area that we're supporting along with the state.
Mayor Young, can you talk about what you and the other county executives discussed with Mayor Hogan today in terms of the eventual recovery plan?
Yeah, what we discussed with the governor was to give us a heads up when he's going to make his press conference to talk about reopening and those kind of things. And he was very cordial in saying that he would do that. Because a lot of times he had his press conference and we got it when you got it. And we didn't think that was fair for us. So we got all this squared away and we're looking forward to our continued work with the governor.
Did he give any indication when such a reopening announcement could be coming or what it would entail?
Well, I think he's having a press conference tomorrow at 5 p.m. But we as the county execs around the state, we don't feel comfortable right now to really open right now. So we're going to continue to follow the advice of our health professionals and decide when they say it's time for us to relax some things, we'll do it.
Mayor, will you support a phased-in reopening where places like Baltimore that have gotten hit maybe harder than other parts of the state open a little bit later, something like they're considering in Virginia and Pennsylvania?
I will refer back to the statement I just made. We're going to take the advice of our health care professionals to tell us when they feel it's safe for us to, reopen. And then we can talk about phasing things in.
Is there any timetable that you are even looking at? Do you think this month, June?
Well, I'm not a healthcare professional. I worked in healthcare, but I'm not a healthcare professional like Dr. Zavasa and Dr. Burns. We're going to rely on their expertise because we want to make sure that we protect all of our citizens in the city of Baltimore.
Anything else?
If the governor does announce a phased reopening tomorrow, would you follow it? I know Montgomery County has said that because they are one of the hardest hit in the state, that they may not follow that guidelines, go on their own.
We all going to make that decision jointly as the Big Eight. So we're going to talk to each other and make sure that any phasing of openings that is coordinated with all of us.
You're talking about the largest jurisdictions,
Yes.
the 8 largest
Right.
jurisdictions?
Even though we're talking to everybody, Jane, we're talking to all of the counties, whether they're in small counties or not. Some of them are commissioners. We're talking with everyone, but the Big Eight will decide when we do our phasing in of openings.
Mayor Young, I just want to ask you quickly about the mowing contract with the city. I know you've reluctantly voted in favor of it, but I know we just got some new info today that there's been 1,000 complaints against this company that you've brought up in the past, that there was some issues. Can you just kind of talk about where you see us going forward after this 3-month trial?
Well, I believe in second chances for anyone. And I was a little disturbed by Fox 45's, reporting of that. Like it was a misstep on my behalf. It wasn't. And also they said that I should have had a contingency plan in place. I just became mayor. They knew I was complaining about that contract. They knew that I said as president when that contract come back that it was going to have problems with me. So the agency should have had a contingency program in place long before I became mayor. So what I want and what I expect out of any contractor that does work in the city of Baltimore, to give us what we pay for. We spend millions of dollars for mowing and other services throughout the city of Baltimore, and mediocrity I'm not going to put up with. I don't care who it is. So I'm doing what any citizen would want me to do to protect their investment. And if you're going to mow like you would mow your own lawn at your own home. You edge it, you clean it, you take the trash away. So that's it.